To assemble a medical oxygen tank, seat a matching medical oxygen regulator on the tank and hand tighten the retaining screw. Using the matching wrench, turn the valve stem counterclockwise with the gauge facing away from you and listen for leaks. Fully open the tank and then turn back 1/4 turn and check the tank pressure. A full tank has 2000 psi and should be refilled when the tank pressure reaches 500 psi. Attach the tubing to the barbed oxygen outlet and set the regulator to the desired flow rate. For a nasal cannula, this should be 1 to 6 liters per minute. Place the prongs of the nasal cannula in the patient's nostrils and secure the tubing behind their ears to keep it in place.
Pressure is 1500 psi.
A non-rebreather mask is capable of delivering 10 to 15 liters per minute of oxygen to the patient. Pre-fill the reservoir bags on NRM or BVM masks prior to placing the mask on the patient. Place the mask on the patient and adjust to ensure good fit around the face.
Watch for chest rise and fall, and then also check for the bag. When he exhales, the bag will inflate, and when he inhales, the bag will deflate.
The correct size for a nasopharyngeal airway is the length from the patient's earlobe to the tip of the nose. Lubricate the distal end with water-based gel or the patient's saliva. Inspect the nose for obstructions or septal deviation and choose the most open nair. Insert with a beveled opening turned towards the septum and slide towards the back of the nose. Seat the flange on the base of the nasal opening. The OPA length should be equal to the measurement from the patient's earlobe to the corner of the mouth. Insert the device with the curve towards the roof of the mouth and rotate while advancing it fully into the mouth. The BVM is used to ventilate an unresponsive patient in situations in which the patient's tidal volume is inadequate. Tilt the head back to open the airway and ensure a proper seal with the face. Ventilate smoothly and observe the chest rise and fall, taking care not to ventilate too forcefully. Test your suction circuit by kinking the tubing and listening for the change in the vacuum pump tone. Measure from the tip of the nose to the earlobe on the patient to note how deep to insert the suction tip. Insert the suction tip with the whistle hole open and close with your finger when you reach the pre-measured depth. Suction in a spiral motion as you withdraw. Suction for no more than 15 seconds in an adult. You may be called upon to assemble an ET tube in the field for a paramedic. Insert the stylet so that the tip reaches but does not pass Murphy's eye, and bend the stylet to the set depth. Fill a Luer lock syringe with 10 cc of air and attach to the inflation part of the test cuff. Deflate the cuff and hand the ET tube to the paramedic. To ventilate a patient with an ET tube, ensure the ET tube is stabilized and ventilate smoothly using the bag. Observe chest rise and fall. The pocket mask should be secured to the face with a two-handed grip. Deliver a breath and observe the chest rise and fall. When finished with oxygen, close the valve stem with the wrench and bleed the pressure from the regulator. Remove the regulator and stow the tank.